We are bridging all the gaps that have keeping for many years those folks to fall into the cracks.
PWA is a community hub for people living with HIV, a place to get a hot meal, pick up groceries, have a jam sesh, paint, mingle, and now, more crucially, receive life-saving medication.
I would say from my own experience, so I'm a person living with HIV, and when I migrated to Canada, so my immigration status was very precarious. No medication.
Ower Oberto came to Canada in 2014. Imagine the stress of not knowing how to, or even if he could, source his medication as a newcomer.
For example, my medication costs more than $1,200 per month.
11 years later, he heads up PWA's new clinic, providing people with HIV medication free of charge.
We don't require any OHIP, IFH, any sort of coverage. Could be somebody that is born and raised here in this country, but is on the streets and doesn't have a health care, but it's totally divorced from seeking health care. But also we have folks that are new to the country, they are visitor or they are non-status, and they are really having access to their medication.
They're staffed with 2 nurses and they see patients once a week.
Through a blood work, they can get the diagnosis of HIV. But with that diagnosis, with that piece of paper, by itself is nothing if we don't connect them with a doctor that is going to give them a prescription.
The clinic, through its partnership with health organization Freddie, which specializes in HIV prevention and care, sets clients up with patient assistance programs offered by pharmaceutical companies.
They leave these premises with medication for at least 7 days until they get the medication delivered or they receive it here.
The HIV clinic is in its pilot phase right now, but Oberto has big dreams of scaling up, so the clinic can serve more people with extended hours.
We are looking forward to have here more hours.
A decade ago, the United Nations set a goal of eradicating the HIV epidemic by 2030. As Oberto points out,
we committed to eradicate the AIDS by 2030. So this is the best way to do it.
Chiasson, CBC News, Toronto.